Hi there. As an Alberta Health Services nurse working on a surgery unit, I know people worry about having pain and nausea after surgery. Part of my job is to help keep you comfortable and safe after surgery. Nurses like me, along with the rest of your healthcare team, will work with you to keep your pain and nausea under control. This will help you to breathe and move more easily, eat better, and sleep better. This means a faster recovery for you. To track your pain, we'll ask you to tell us how much pain you feel on a scale of 0 to 10. 0 means you have no pain, and 10 means you have the worst pain you can imagine. We'll ask you to rate your pain when you move and when you're at rest. Your pain score helps us choose the best way to treat your pain at that time. Our team will do everything we can to help manage your pain, but you still may feel a little bit of pain. We'll try to keep your pain at a 4 or less. If your pain is more than a 4, it's important you tell your nurse as soon as possible. That way we have time to give you pain medicine before your pain gets worse. In the hospital, we often use a mix of medicine to treat your pain. This may mean pills, injections or shots, and intravenous or IV medicine. Medications include narcotics, like morphine, anti-inflammatories, like ibuprofen, or other painkillers, like acetaminophen. You may also have an epidural. An anesthesiologist will talk to you about your options before your surgery. We also want to make sure that you understand what medicine you're getting and why. Never be afraid to ask your nurses and doctors questions about your medicine or anything else. No one wants nausea after surgery. That's why we start managing it before your surgery even starts. We'll ask you a lot of questions in a health history. This gives us a better idea of how likely you are to have nausea after surgery. We may give you medicine for nausea before your surgery even starts. After surgery, we will ask you to use a nausea scale to tell us how you feel. It's just like the pain scale, where 0 means you have no nausea and the highest score means you have the worst nausea. Your nausea score helps us to choose the best way to treat your nausea at that particular time. Again, we'll try to keep your nausea as low as possible. Please tell us if it's getting worse. Although we're being mindful of your nausea, we will encourage you to eat soon after surgery and not just Jell-O and juice. You'll be offered low-fiber, small meals soon after your surgery. Choose what you want from your meal tray, but don't feel you have to eat it all. Start with a little bit of food and eat only as much as you can. Every day you'll be asked to write down how much you ate and drank, and if you vomited at all. You'll also be asked if you passed gas or had a bowel movement. These are all good signs that your body is getting back to normal. Our team will do everything we can to help you manage your pain and nausea. But remember that you play an important part too. By telling us how you're feeling, you'll help us to keep you comfortable. We're looking forward to helping you get better sooner.